Hi, everybody. So today we were supposed to do a podcast, and the topic of the podcast was going to be advice for pre-med students. There are two pre-med students that were going to interview me. But the funny part is that they're going into medical school, so they're really busy. And so they had to cancel for the day. But since I was planning to talk about pre-med advice and getting into medical school anyway, I figured that we could just do it for you guys specifically this morning, even though it's not going to be on the podcast right now. But so last time, last time we all met, we talked about some specific advice. And Sri, did you send out the JAMA article about professionalism and how to dress professionally and the impact that it has on patients to the students?
Not yet, but I can send it right now.
Okay. So one of the things that we talked about last time, which seems like a silly piece of advice, and disclaimer, I'm not about like people judging people for what they wear, and like especially like sexist stuff. Like I would get in trouble for wearing leggings even if it was under a dress. Like that's not what I'm talking about. I'm talking about just not wearing sweatshirts, sweatpants, t-shirts, and tennis shoes. It's just good to kind of look like you care about what's going on, and it's a generational thing. I actually saw on one of my physician groups the other day that the attending physicians were talking about that medical students and residents kind of dress like bums nowadays. And so I think that it's kind of maybe the younger people want to be more casual, and that's fine. But you have to remember that when you're in medical school and you're working under attending, they're statistically going to be older than you. So they're going to have this old school mentality that you have to be professional looking in your attire. Again, I'm not getting into like the whole like judging people like their style. I'm just saying like no sweatpants and sweatshirts and t-shirts and tennis shoes. And then there's the JAMA article about how patients perceive their provider based on what they're wearing, and it goes into different specialties. For example, it's talking about that they prefer the surgeons to have scrubs and like a white coat, and they prefer internal medicine to have professional attire with a white coat on. And the perception of those providers with the more professional dress is that they're more trustworthy, more intelligent, and patients feel more comfortable taking advice from the individuals who are more well put together. And it's difficult because, when you're working 80 hours a week, you might not have time to iron your clothes before you go. So again, I don't want to harp too much on it, but just try to not wear like pajamas. Okay. Now, do you guys remember some of the other pieces of advice that we discussed during the last session?
I think someone mentioned how to balance like mental health with being in pre-med, such as like imposter syndrome and stuff like that.
Yes, that's exactly right. So imposter syndrome is something that people talk about a lot. Does anybody want to give the definition of imposter syndrome? Miriam?
What?
Do you want to give the definition of imposter syndrome?
That's when
Come on, get on camera. You can be a YouTuber.
I think that's when you kind of like devalue yourself. So like even though you have like the like credentials or experience or like for example, like you're a straight A student, you have like a lot of stuff going for you. You're like really well put together, but because you don't see that in yourself, you start to like devalue yourself. And right?
Yes. So you are worthy of whatever's going on, but when you get to the place, you start doubting yourself and you feel like you're an imposter, you don't deserve to be there, and that sort of thing. And so that is kind of what happens when you go to medical school, because you're used to getting straight A's, you're used to being the best of everything and like the top of your class, but then you're put in a group with other people who are also the best at everything and also the top of their class. So you can't continue. You're in like the 99.9999 percentile, and then you fail your first exam ever, and then you're like, oh my gosh, I never failed anything before in my life. I don't deserve to be here. I'm not going to make it. And then you start doubting yourself. So have any of you ever experienced that? Like you got into a position and then you felt like you weren't up to the challenge?
I feel like a lot of medical positions are like that, especially once you get to like college. So I know that in high school, like if you volunteer at Nova, sometimes it's just like at like gift shop or like wheelchairing people. But now that I'm in like college, I can do like kind of more like taking vitals and like more patient interaction. So I think that does scare a couple of people, like, oh, like what if I do the wrong thing, or like, take vitals wrong or something like that, because it is like related to someone's like health. So I think just understanding that like everyone is learning, like the first time you learn something for the first time. Like I've never properly taken vitals. I think it was actually at your office when I was shadowing one time that it was like my first time. So yeah. So I think like just understanding that like there has to be a starting point somewhere. So like just understanding you're kind of learning and not putting too much pressure on yourself to like be perfect, especially at the beginning.
Right. That's a good transition to the point about balancing your academics and your mental health, is to not strive to be perfect, because okay, so in medical school, like you have a bunch of different classes and you kind of you cannot, well, some people maybe can, but I doubt it, cannot get perfect scores in every single class. So for me, I would pick like, okay, so in medical school, it's not like ABCD, it's like fail, conditional, pass, high pass, honors, or whatever. So it would be like, I have one class and I have like a high pass, and another class I have like a conditional. So I'm like, okay, I'm going to study less for the high pass one, get a pass, and then put that time into studying over here and bring up a conditional to a pass. That way I have two passes instead of a high pass and a conditional. You know what I mean? So you gotta like pick, like, you only have so many hours in the day and you have to use all of them. I mean, I would actually listen to our recorded lectures on 2x speed on the bus, in the shower, just when I'm walking. I'd always have headphones in and I was always listening to lectures. And you gotta have your mental health as a priority too. So, like, let's say you are doing pretty well in a class, you could study a little bit extra, maybe like honors, or you could go get a massage and meditate. You may want to just high pass that class and go focus on your mental health. So, oh, my battery's low. You don't want to aim to be perfect at everything, because I don't like the term burnout, because that implies like you're doing something wrong, but you'll get just so exhausted. Nobody can do everything, right? So you maybe make your mental health as much of a priority as like one of your classes or something. Okay, so what else did we talk about last time? Who remembers?
I think someone also brought up how to get involved outside of school, like shadowing and looking at other opportunities like clinical hours.
Right. And do you remember what I said?
Yeah, I think you mentioned just reaching out to whoever you saw. I'm pretty sure you mentioned this one documentary where you reached out to, I think, the producer. I don't remember exactly, but asking if you could work with him, and he was open to it. So you said mainly just reach out to them, which is like the first step of any process of getting involved with anyone. And after that, people are more likely to reach back out to you, because you're never going to get someone who says no and like degrades you for asking, but more of like someone who might be hesitant to let you in or just let you in anyways.
Right. So I was gonna say, like, the worst thing they could do is ignore you, but I guess the worst thing they could do is send you like a nasty email. But like, it's their loss. So if you just email a whole bunch of people that you think would be interesting to work with them, statistically maybe like 10% of them will reply to you, but then you have an opportunity right there. I think there's more people that need let in, so give me a second and see what. I was getting private messages. Oh, I guess I don't know what's going on here.
It would have shown up at the top.
Oh, okay.
Okay. Wait, real quick. I know now after COVID, a lot of doctors are overwhelmed with a lot of pre-med students emailing them for shadowing and stuff. So there's this one resource online. It's called e-shadowing. And it's with Dr. Ryan Gray, and he brings different doctors in every week, and they do a live shadowing session, and they give you hours for it. So if you need anyone for shadowing, that's a good resource as well. Just thought of that.
Wow, Miriam, 10 out of 10. Okay.
Yeah, and I've
Well-
honestly like, so I'm looking for positions like back in Florida, like when I go back to college in August. And when I tell you, I literally have like a list of 30 places I'm calling, or like 50 places. And like now like 2 or 3 are like calling back for like interviews. So like I would say like like ask broadly, right? Like don't just ask a couple places that you know of or like have heard of. Literally, like what I did was like I searched up on Google dermatology practices in Fort Lauderdale and literally just went down the list on Google. So I think like doing something like that where like it's broad, and let's say like I'm interested in maybe like working in dermatology. So then I was like, okay, I'm looking at those practices, and you know we have like so many in Northern Virginia. So yeah, I think just applying broadly too is kind of important.
Yeah, it's my understanding that it's pretty hard to find a doctor to shadow just because they're obviously like so busy and there's a lot going on. And then when a student's shadowing them, no offense, but it slows them down a little bit. So maybe they're not really as willing to take on students. But I think Miriam was onto something with that resource there. Okay, so the shadowing, well, if you guys log your 20 hours, you can shadow me and that'll take care of that. And let's see, so we also talked about like pre-med groups at colleges and how I went to a college that did not have a pre-med group. So then I snuck into the University of Pittsburgh's pre-med group. I mean, it was a huge school. What did they know? So if you don't have an active pre-med program at your school, you can maybe look into other schools or just say like, hey, sometimes there's like reciprocal universities. Like I went to Chatham and they used to be like connected with Carnegie Mellon and we could like switch classes and stuff. So maybe if your particular school doesn't have a pre-med program, it could be affiliated with another school that does. So you might want to look into that. Miriam, what time is it?
9:26.
9:26. Okay. Just don't want to be late for any of my patients. Okay. So another piece of advice is getting letters of recommendation. So do you all remember what I said about getting a letter of recommendation from me? This is the part where you jump in and say, yes, I do. It was da 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 da.
Yeah.
Okay, so what did I say? How do you, okay, I gave an example of how to get a bad letter of recommendation, and then I gave an example of how to get a good letter of recommendation.
You sorry, you discussed that we're supposed to fill out like our log sheet, and the more specific that you are in the sheet, the better your letter of recommendation will be.
That's exactly right. So I gave the example of like somebody just wrote, okay, I spent an hour reading an article. So then I go to write their letter of recommendation and I type, they spent an hour reading an article. Like that sounds kind of generic. But if you write like, I spent an hour reading an article about ankylosing spondylitis, and they're like, they spent an hour reading about ankylosing spondylitis, it's going to sound a little better, right? So the more specific you are when you record your hours, the better your letter of recommendation would be. So because I love teaching and this is like my passion, I write really good letters of recommendation, very specific. They're not just like boilerplate, like just a template where I like Control F and delete your name and switch it with somebody else's. A lot of attendings and professors will just do that. I like to get very specific, and that's why I institute the hour logs. But not all the people you're asking for letters are going to be like me. Some of them may have like no clue who you are. Weirdly, a lot of them will be like, you write it yourself and I'll sign it because they don't want to take the time to write it, which I guess that's it's interesting. It'd be like, this is the best, most spectacular student in the entire world. I don't know, but I feel like that's just a little bit lazy on their part. But you know, the people that you need letters from are typically people that are extraordinarily busy. So they probably don't have much time to write letters. So in order to get a good letter from somebody that's not me, you need to make sure that they know who you are, because especially if it's a professor and there's 200 people in the class, like they're not going to know what to write about you. And if they don't know what to write about you, it's just going to be a super generic letter. So looking back, I was probably extraordinarily annoying in college, but I was always at the professor's office during office hours. I was always participating during lecture. I was always staying afterwards to ask more questions. I was always emailing and sharing like interesting fact. Like I was very, very outgoing and social and interactive with the professors. So they definitely knew who I was. Like there was no question. Stephanie Waggel, all of my professors knew exactly who I was. So when I asked for a letter of recommendation, they didn't have to be like, who are you again? What class of mine are you in? They were like, oh, Stephanie Waggel, you basically live in my office. Okay. I can definitely write you a letter. So obviously, if you're not like me, you can't do that with every single professor, but pick the professor that you want the letter from and make sure that you have some kind of relationship with them, like visiting their office, emailing them, contacting them, asking questions during like that sort of thing. So that they're able to differentiate you from the other 199 students that they teach, and then they can get specific. Now, another thing about asking for a letter of recommendation, especially if when you're applying to medical school, Miriam, they still do AMCAS for so the AMCAS, basically there's like a deadline and you have to have all the stuff in. And if you don't, then you miss this whole year and you got to wait another year. And I had one professor who for like months, I was like, okay, I need it. I forget, this was a long time ago. I need it like October 1st or something. And so I asked in like July and then August, September, and then like in September, I'm like, please, please. I kept saying, it's due on this day. And then like he would wait until like 11:59 p.m. the night before, and then you get a little bit of anxiety, right? Because if it's not in, then you wasted like an entire year of your life. So I'm not saying to lie, but I'm saying that you should say, I would like to have this in by like September 1st, right? Because a lot of times people are going to wait until the very last second. I actually had to find his wife's phone number and call his wife at home, like, which is horrible, but it's like I would have literally had to postpone my application by an entire year if everything wasn't in by the deadline. And then finally his wife was like, oh yeah, he's been meaning to do that, but he's been real busy. And I'm like, I have to go to medical school. I can do it right now. I'm gonna cry. So if I would have said like, I would really need you to have this in by September 1st, and then maybe it would have not been so anxiety provoking and I wouldn't have had to call his wife. But you guys definitely need to realize that attendings and professors and PIs and the people that you work under are extraordinarily busy and may procrastinate. So if you need a letter, you want to give them as much time as humanly possible. Like for me, like I like 3 months, but I mean, I'm cooler. I can adapt to that, but definitely ahead of time pick, okay, this is the person I want the letter from. I'm going to spend lots of time with them, and then I'm going to give them lots of heads up, a lot of notice,